everyone, this is a quick demo of MediQo, including all its AI scribe functionality for clinicians, and this is something that you have access to completely for free within your clinic. To start documenting a patient or client visit with AI, you can either have a look at your patients list from the menu on the left-hand side, or you can click on your appointments for the day. When you do this, this automatically syncs with your PMS. So if you're with Best Practice or MediQo, MediQo, etc., you'll see that this automatically syncs with your appointments, your specific appointments as a clinician for the day. You can also search a patient. So if you type in the patient's name, perhaps if they're a walk-in, you can type in Mia, and note this is a demo environment, so it's only going to show Mia's name there. And we can click on any of these patients now to start an appointment. When you click on the patient, you can review their details and then click in the top right corner to start a visit. And here you can choose whether the consultation is in clinic, at home, and also what the consult type is, face-to-face, telehealth or phone. For this one, we'll choose face-to-face and clinic visit. We'll make sure our microphone's working and we'll click to start a new visit. Allow the microphone settings and MediQo will automatically start listening for you. You'll also see on the right-hand side a really quick patient at a glance or history at a glance summary. And what this will do will summarise their key complaints from the last 5 visits so that you don't need to trawl through history. You can have your consultation with your patient as you usually would. When you're ready and you've finished the consultation, click Stop Consultation. And this will automatically start generating the notes for you. You can also upload the recording. So if you've had a consultation maybe in home or off-site with a patient, you can choose to upload the recording later instead and generate your notes that way. Choose the file and open. This will take a couple of moments to upload the file for you. And the notes will start auto-populating for you. The standard note style, as you can see on the left, is a SOAP note, but you've also got options for formats like brief SOAP, CSHA, ISOBAR, follow-up, mental health, telehealth, etc. When you're reviewing the notes, if there's something that you'd like to change, you can use the prompt box below to do that. The system will automatically generate a new note for you according to your instructions. You can copy this note into Best Practice, or if you have MediQo, MediQo, etc., there's a direct integration. You can also print the note, download it, upload it, save it, or email it. If you highlight any of those bullet points or any of the content in your notes, you can also delete it or edit it directly. If this is a note style that you particularly like and want to use again once you've made your customizations, next to the copy button down the bottom, you'll see a save note. Click that and this will automatically add it to your template library. Choose a name for your note and click Save. If you scroll down, you'll also see options for automatically generated differential analysis, care plans, treatment plans, etc. And the differential analysis can be a fabulous tool for training. If we click on Care Plan, this is particularly useful for patients who are eligible for care plans or GP-CCNPs. The plan will detail all of the relevant information and is already created for you in a Medicare compliant format. If there's anything you want to add, you can double click and add, delete or amend as needed. If you click on Treatment Plan on the left-hand side, you'll see that this is automatically generated for you as well. And this includes information about the diagnosis, any prescribed medications, follow-up recommendations, and any clinical guidelines alignment that you've discussed with the patient during your consult. There's no need to manually type or create this plan. If you need to write a referral, you can click on Referral Letter on the right-hand side, and you can choose which specialty to refer to from the drop-down. MediQo will automatically include all of the information relevant to that specialty, and it will omit any information that's not relevant to that specialty. So if, for example, you've had a patient present with knee pain and headaches or migraines and they're unrelated, then only the information pertinent to that specialist will be included in this referral note. You'll also notice that there are copy buttons down the bottom so that you can copy this information directly into your PMS template without needing to remove or double up on the headers or footers or address details. If you click on Patient Education Letter on the left-hand side, this is a handout that can be used to share with your patients all of the information that was discussed during your consult with them. It includes information about their condition, medications, any side effects, and any lifestyle advice that you've recommended during your consultation. And this can be a great tool to help patients remain informed and compliant with their medication or treatment without you needing to do any additional work. You can copy this information, download it as a PDF, or email it directly to the patient. If you've got the patient's details, this will automatically open up in your email client and you can email the patient this information if needed. If you have clinical forms you need to fill out, you can click on Forms on the left-hand side and browse forms by state. Let's choose workers' compensation on the right-hand side as an example. If you scroll down, you can see that the patient name has been included, date of birth, when they were examined, any details, and anything else that was able to be picked up from the consultation that they've had with you automatically. Check the details, fill out anything missing, and then print or save or download as you usually would. You'll also see on the right-hand side observations, so if you've talked about weight or BMI or blood pressure or any other patient observations during your consult, these will automatically chart here for you and keep a live graph of any changes to their observations over time. Beneath that, you'll see MBS suggestions, and this is connected in your clinic to PRODA and MBS Online, so you can see live recommendations for which MBS item numbers to claim based on the patient context, your qualifications, and the consultation. When you click in, you'll be able to see details. Just beneath there, you can see an AI medical assistant. And this can be used to ask any question related to general medical information, and the answers only pull from verified, evidence-based clinical sources within the Australian context. The AI will generate the answer, and will also include details of where the information sources are pulled from. You'll also see suggested questions that may assist you to find out more about that patient while you're in consultation with them. If you click the box Include the Conversation, the AI will generate answers based on the consultation history. When you're ready, you can finish the visit, and this will automatically save in MediQo history for you to revisit when you need to. If we navigate over to Template Library on the left, this is where you can access the note templates that you created before and choose to either delete them or pin them. And if we navigate to snippets on the left-hand side, this is where you can set text shortcuts. Type in a document shortcut and paste below a paragraph of text that you would like to replace that every time you type that shortcut. Click to add a new snippet, and this will show up anywhere in MediQo where you are writing notes. If you need AI to assist with any other part of your patient information or documentation or treatment management, you can come into this AI clinical assistant and use it to generate documents for you, analyse data, create training manuals for new staff members, summarise previous history, or anything else that you may need from a general AI agent. And remember, in MediQo, everything is secure and built specifically for Australian clinical guidelines. All of the tools we've shown you today are completely free and available to you within your MediQo platform. Your practice manager will be able to set you up with free access to the platform, including all of these features, and you can request detailed training at any time.